balloon is a soft, smooth, durable balloon made of silicone rubber. It is designed to be placed in the stomach to reduce its capacity and help you feel full with less food. The deflated balloon is inserted through the mouth and into the stomach by a doctor using an endoscope, which is a thin, flexible tube. The balloon is then filled with saline solution, also known as salt water, to occupy space in the stomach, leaving less room for large amounts of food and drink. The idea is to help you feel full faster after eating smaller meals and maintain that feeling of fullness longer as you are less hungry between meals. Today on your regular Health TV talk show, The Physicians, we'll be discussing gastric balloons, a non-invasive weight loss tool. Stay tuned. It's another day with The Physicians, where your health is our business. Today we'll be discussing gastric balloon, a non-invasive weight loss tool. My name is Dr. Martina Agbere, and with me in the studio is my co-anchor, Dr.
Memuna Yusuf Kadri. Welcome to your favorite Health TV talk show, The Physicians, where your health is our business.
And will always be our business. Discussing gastric balloon, a non-invasive tool for weight loss management.
Yeah. I've had experience with that, and I think for me, that should be my very first, vivid and close to. You will hear people have done, or in med school you hear story, but then it wasn't like common.
Okay,
but
you talked about a patient, right?
Yes.
That you had to manage.
Yes.
So you want to just relate that?
Yes. So that gastric balloon came in place because the patient is an alcoholic.
Okay.
And that is one thing that you avoid if you have a gastric balloon. She's alcoholic. She was an alcoholic, and morbidly, she was really big. Like, she really needed to lose weight. And so the doctors, apart from me seeing her, so I felt that, you know what, if she has to lose weight and she's taking her, let us join. Have the combination. So she had the gastric balloon, and of course she wasn't taking alcohol. In 6 months, I think she lost like 30 or 31. Yes. Oh, she lost weight. But the question is, did she add the weight back? And we have a guest in the house. I think I don't want to.
We have a lot to discuss today that has to do with this gastric balloon. So many information that is out there that are not right.
Misinformation.
A lot. That's why we have the physicians. We try as much as possible to counter those information that are not right. So we'll be back after the short break, because we have a very, very cerebral guest whose expertise is on this. We'll be back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome to your favorite Health TV talk show, The Physicians, where your health is our business. Today we'll be discussing gastric balloon, a non-invasive weight loss management tool. And in the studio with me is no other person than our very cerebral Dr. ADEDAYO AJAYI. He is a consultant, surgical oncologist with interest in cancer and BOWELS. He is the MD, CEO of Renaissance Medical Center. You're welcome to our facility.
Thank you. It's
You're
always
welcome.
Nice coming to the Physicians show.
You look really good, Dr.
Yeah.
AJAYI.
Thank you. Thank you.
I don't know, we're going to discuss gastric balloons. Wow. Oh, we don't have much time, because I know you have a whole lot to debunk out there. So we're going to start with, maybe just tell us first some foremost, seeing that this balloon we're going to deal with, and it has to do with weight loss, the best tool, the reason why we're using this, obesity, right? So will you tell us a little thing about obesity? and why we have to do this.
Thank you for having me on your show. It's always nice coming to
You're
the
welcome.
physician show. This is a very important one today because as we get old, we put more pad on and becomes more and more difficult to shed weight.
I agree.
It is well recognized that carrying extra weight comes at a very, very high price.
Okay.
Or name it, all the diseases you can think of. Stroke, cardiac problems, hypertension, kidney problems, diabetes, arthritis, cancer. They're all associated with carrying extra weight. So, over the years, all sorts of tools have come up, tablets, medications, but most of them come with side effects.
Okay.
So, this latest addition, the gastric balloon, the beauty about it is that it's the least invasive of all the tools.
Okay.
It is put in through what we call endoscopy, through the act of endoscopy. Anytime you hear scopy, especially endoscopy, it's through natural openings.
Okay.
So in this particular case, because we want to put it in the stomach, it's called gastroscopy.
Okay.
We carry out gastroscopies in tens of thousands every day. So it is a very safe procedure. It does not involve making any incisions. In other words, it's non-surgical. That's the big sell of point about it.
Okay.
And the balloon is positioned in the stomach within 15-20 minutes. The procedure is over.
Wow.
So the function of the balloon really is to occupy space in the stomach.
That is matter.
Yes. When do we feel hungry? When the stomach is empty. So the stomach is tricked into thinking that the balloon is food.
Okay.
Yeah. So there are various types of balloons. The ones that we live there, that when we say 6 months or 12 months or even longer, we don't mean that it has to be there for those lengths of time.
Okay.
But those are the maximum periods that they're licensed for.
Okay.
So if you're carrying the balloon for 2-3 months and you've achieved
Your goal.
your goal,
Take
Take
it
it
you
out.
can have it out. If you have the balloon put in and give it a few weeks and you think you are not happy with it, take it out.
No pressure.
So the balloon is just one part of it. So when you put the balloon in, the other aspects, of course, the purpose of the balloon is to
Occupy.
occupy.
Yeah.
Yes. So it's portion control because it occupies the space in the stomach. The average balloon is about 1/3 of the stomach. But because when we insufflate the balloon, it stays in the middle of the stomach, in actual fact, you only have 1/3 of the stomach to play with. So
Okay.
for illustrative purposes, that's the stomach. And that's the balloon. So it stays in the middle of the stomach, and you only have that upper portion to play with.
To play with. Oh.
And I always tell my patients, I use an analogy. If you go to the gym every day, you're lifting weights, what happens to your muscles? They become bulky.
Okay, yes. You're building them.
Yeah. And when you stop doing that, what happens to the muscles?
They go back.
They go back. So the stomach is a muscular tube. Yes, it acts as a reservoir, but it's a muscular tube. So if you put in the balloon for a period of time, you're not eating as much as you used to, what happens to the muscles?
It's flat.
They atrophy. In other words, they become smaller.
Smaller.
So your stomach actually becomes smaller.
Smaller.
So when you take the balloon out, yes, you will know yourself because you've gotten used to eating small portions. When you are eating beyond that portion, you will know you are just eating because the food is there.
Yeah.
So there's a big element of self-control after the balloon's out. But more importantly, for the period the balloon is there, you use it to actually effect a lifestyle
Change.
to effect lifestyle changes. So not only is the balloon controlling the portion, you must also pay attention to what you're eating. So you eat healthy. You cut down the carbohydrates. Beef up the vegetables, protein and proteins. You will not be able to eat like most adults are used to eating breakfast, lunch and dinner. You eat small quantities, but you will work out what works best for you.
So maybe eating small quantity or more, as against this
yes, but
3 times
but
a day.
you will find out that you cannot eat the same quantity anymore,
at the same time,
and pay attention to the contents of what you're eating.
So Dr. J, at this point, I like the fact that you are breaking it down for us to know how this occupies space, and of course it just has a little part to play on above the balloon, and of course portion eating. You don't just say because now you have something in, so let me just be eating anyhow. I know it's just small that will enter my body and all that. So what are these indications? Why do people even go for this type of procedure even in the first place?
Well, those are needed.
And why do they even need it?
Okay, I tell my patients, you want to lose weight, you must first of all make that decision yourself.
Mindset.
Amazingly, some people you consider, there's what is called the body mass index.
Yes,
exactly.
That is our yardstick. So once you are above 25, 26, really, you're obese. You are overweight. Overweight. But when you are approaching 28, 30, you're obese. So you have some patients that will come in, say, I want to look good for myself. So it's important you make that decision yourself. And then, of course, the health hazards we've talked about. Maybe they're on treatment for hypertension. You have some people already having kidney problems, diabetes.
Okay.
And we know that diabetes becomes more easily controllable when you cut down the weight.
Yeah, exactly.
Yes.
You're right.
So they come in, but it's important you assess your patients first and foremost and counsel them. I don't hide it from my patients. The first 5 days to 7 weeks, 7 days maximum, 5 days to 7 days maximum, the stomach will see this as food.
As a foreign body.
As a foreign body. Once you push it out, so you're likely to have some griping pains. But we'll give you tablets for that. You're likely to feel nauseous. We'll give you tablets for that. Occasionally you may vomit, but it doesn't last more than a few days. So then comes the hard part. To monitor what you're eating, we get involved with the dietitian, and then, of course, the last aspect of it, exercise, lifestyle changes. So exercise doesn't mean that you have to go. If you find the gym, but even if you go to the gym, then don't go for things that will make your muscles, because otherwise you may be losing fat, but your weight may become stagnant.
Yes.
So I tell patients the best exercise is swimming, but you have to be really rich to have a swimming pool in your house. So, or have access to a swimming pool. But walking is good, because when you are carrying too much weight, what happens to the joints? They're complaining as well. So the last thing you want to do is to be jogging.
Yeah, absolutely.
You have arthritis. Yeah. So walking is good and it's free. And I tell my patients, whatever you're doing for exercise, make sure you don't regard it as a punishment. So make it fun.
Yeah.
So
I know you always put music on.
You can always put on music. If you like watching programs, or whether you want to follow religious programs, put your screen in front of your treadmill.
Yeah. And do that.
So by doing that, you don't regard your exercise as
pain.
And in fact, you're looking forward to it.
Well, Dr. AJAYI, I know you still have a lot to talk about, okay? And it's getting very interesting, and so many things to still ask. You've told us about the balloon, you've told us about the indications, those that require it, and we still have a lot of questions to ask. But people are getting it's very interesting, and they're getting very interested. I know in their hearts they are saying something, which I will ask you, okay? Because we need to keep a date with our audience, the physicians out there. Let's hear what you have to say. Have you heard about a gastric balloon before? I'm sure on social media you have seen a lot of people shed so much weight. So we say from exercise, or we say from diet. Some tell you they had to do surgery, but here it's one you don't require surgery. So let's hear from you. Have you heard about gastric balloon before? A process whereby a balloon is inserted in your stomach. Back after the short break. Stay tuned.
No, I'm not aware of it.
No, I don't know.
Every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show. The physicians, where your health is our business. We've been discussing gastric balloons. Wow, gastric balloons. A non-invasive weight loss tool. And in the studio is a consultant, a very cerebral one at that, with interest in cancers and bowels. He is the MD, CEO of Renaissance Medical Center. No other person than Dr. ADEDAYO AJAYI. He has told us so many things about this gastric balloon, and the interest is just building. The way you are feeling right now, right? We're even feeling much more than that here in our studio. And we need to ask him, you have said this on, okay, this is what happens for those that have weight management challenge. The gastric balloon is good. This is what we do. Let's ask him one more question, Dr. AJAYI. You've told us so many things, so many beautiful things about the balloon, how weights can be lost using this. So how is it done? How safe is it? The procedure, let's talk about it. How do you really accomplish this?
Thank you. It is a very safe procedure. It's done endoscopically. Anytime you hear endoscopy, that means we're passing a tube with a camera and light source at the end through a natural opening. And we do this every day. We do most endoscopies when the patient is awake or with slight sedation. But when you want to put the balloon, you are awake. We give you what makes you stay awake, but you are not aware.
So what are the side effects?
Yeah, the first
Because there's not another side effect. What are the expected?
The manufacturer says 3-4 days, but I say 1 week. You may feel nauseous because it's occupying space there, and
it's foreign body.
yeah. You may also have griping pains because the stomach is trying to
Get used to
pass,
foreign body.
yeah, foreign body. But after the first 1 week, the stomach gets used to it. This thing is here to stay. There's no use fighting it.
Yeah.
Of course, for those 5 days, 7 days, we give you medications to help you.
Okay, so I just want to ask a question. Are there contraindications? For instance, children who are morbidly obese, are they also expected to use this? And the very elderly?
For the balloon?
Yeah.
Yes.
Now, the morbidly obese, we've talked about that you will need more than that. So there,
For
you
children,
can bring it.
okay.
For a child of like 15 years old.
You have,
Well, I wouldn't do it for anybody who's not reached adulthood yet.
Okay.
You have to be an adult and make decisions yourself and be sure, so that way reassure me that you comply with the lifestyle changes as well.
Okay. Parents come and they're insisting.
No, I think it's important that the the patient is an adult to make up his or her mind. Yes, yes.
And that's very important for parents out there to know, because some always want to feel that, oh, we can pay the money. No, let because it's a child. Rather, do the lifestyle change. Let the child be disciplined and put things in place, rather than putting the child through this. Though it's non-invasive, but it's good.
Yeah.
But Dr. J, what's different between? Is it different now? Why
the slits?
The balloon as against the slits?
Yeah. The sleeve gastroplasty or gastrectomy, I'm using some terminologies now.
Yeah.
When you hear ectomy, that means you are removing parts. When you hear plasty, that means, and that one is done through the endoscope as well, where you actually suture the stomach to exclude part of the volume of the stomach.
Wow.
To make it smaller.
Yeah, to make it smaller. Yeah, it's done endoscopy. That one is done endoscopy, but you are suturing, and you can still have some complications from it.
It's not reversible. That one is not reversible.
It can be reversed, but then if you think of it this way, that you put stitches there, the stitches become embedded, and you want to cut.
Go back there.
So that even puts you more at more hazard. So the gastrectomy you can do it keyhole, but it's still surgery, and you can have.
All the complications.
It's more invasive than the balloon. In other words, that's what I'm saying. But like I said, the beauty about this now is that you can combine what you call the GLP-1. I don't want to be mentioning any particular name so that I won't be advertising.
Yeah,
yes.
you're right.
But these GLP-1 injections and tablets, they were actually originally discovered to help diabetes control, because like we said earlier on, your diabetes become more easily controllable when you lose weight. And then along the line, they found out that they became licensed for weight loss.
Yeah.
So when we combine them with the balloon, they achieve near equal results to the more invasive procedures.
Yes.
So, Dr. Ajayi, before I let you go, a patient walks in, and two things here. Have you had patients that have come from just a medical management of a condition, and you realize that they really require to have the balloon inserted to help them recover? Or you have those that on their own just walks in and tells you, I want to have a lifestyle, I want to shed some weight?
Both of them. You see that both categories every day. Patients who come in with other things, and then it's finally find, by the way, we can't control your blood pressure, we can't control your diabetes because
of your weight.
Or you are having issues with your joints already, or the weight is predisposing you to even other more serious conditions, hearts, kidneys, and everything. But then you have those who come because they're worried about their weight.
Okay.
So before they start having complications, they want to share the weight.
Okay.
Yeah.
So both.
Okay, so for this procedure, right? Final word. How do you manage them in terms of counseling? Because you can't just come and how long do you take them you explain to them, counsel them? After the counseling, do they still want to continue or they just want to stop?
I bring them in for the initial consultation.
Okay.
They will go through all the likely benefits and the hazards of leaving your weight on, and then measure the blood pressure, the blood test, and everything. The A1C, which is the one that tells us whether they're already predisposed. So many of them actually are in the pre-diabetic state.
Yeah, and they will not know.
They will not know. So when they too see the results and everything, and they know the possible consequences of not doing anything, then they'll come back for a repeat visit.
So, Dr. Ajayi, I know we are rounding up. If you do a gastric balloon, do you need to take any multivitamin supplement?
No, I'm happy you're bringing that up because that's the difference between the balloon and those surgical procedures. Yeah. No, the balloon, it does not predispose you to any nutritional deficiencies. Yes. So that's it. I'm happy you brought that up.
Yeah, because I know that that's a big worry.
The problem with the sleeve and the bypass is that, of course, they go to toilet frequently. You're reducing the absorption area of the bowels and everything, and they become deficient in some vitamins. And
they may be on that for a while.
And most of them may be irreversible. So that's the other thing.
Okay. So you say the balloon, right? As you shed your weight, when they come back, do you?
We actually follow them up.
Okay.
The first visit is 1 week after the balloon, then 2 weeks, then every month. And of course, those visits, you give them targets.
Okay. Yeah.
So
measured metrics to know that.
Yeah, so we'll be measuring every time. And then, of course, you see the dietitians along the way as well.
Yeah. Wow. Very interesting. Well, unfortunately, our time is not always friendly. When you see the director telling you time is up, and we still have a lot to say. So it just means that we're going to invite you again to come and give us some very, very important.
Yeah, maybe gastric that time, and then other non-invasive management of.
It's
a big issue.
Yeah. You're welcome.
It's a big issue right now.
A whole lot. As a consultant or surgical oncologist with interest in cancer and BOWELS, we have a whole lot to talk about.
Thank you very much.
Colon cancers.
Always my pleasure.
Thank you so much for coming to our program.
You're welcome.
And our viewers there, I just want to say thank you for keeping a date with us. You just heard from the consultant himself, Dr. ADEDAYO AJAYI, a consultant surgical oncologist with interest in cancers and BOWELS. Where else? He is a very cerebral consultant. I just hope that you have benefited so much from our program. You've heard all that he has to talk about gastric balloons, totally different from the surgical one. This is the non-invasive one also. And I'm sure many of us did not even know that they will have this kind, where you have to insert balloon for weight gain, for weight loss rather, for weight loss. And of course, diabetic patients, hypertensive patients, so many health conditions then that require weight loss, but you are not able to manage it. That is his field. It's non-invasive. No side effects are very minimal, really, on what he said, not complicated. So I just want to encourage all of us to take our health lifestyle in our own hands. Just ensure you do that, which makes you live better and healthier. The lifestyle is very important. My name remains Dr. Martina Agbere. Till next time, stay blessed.
Thank you very much, Dr.
And a big
Ajayi.
thank you to Dr. Martina, Dr. Memunat,
Yes.
and the physician's crew. Thank you very much for having me.
Yeah, thank you so much, Dr. Ajayi. It's always a pleasure having you here. Just make your aura brings a lot of calm, and we truly appreciate that. So our viewers out there, gastric balloon is one of the newest non-invasive treatment for weight loss. It's not meant for everyone. So if you are already thinking about that, please meet your doctor and of course meet the expert who will advise you appropriately if you have the reasons for you to go through that. Like we said, it's non-invasive with minimal side effects, and you do not have to take any multivitamins for it because you are not actually losing any one of them. Be kind to follow us on all our various social media platforms, and if you just want to be like Dr. Ajayi right here, go to our website, register, click that button, and you'll be right. You do not have to be a Dr. Ajayi. If you have someone who hasn't gone through this procedure and you want to share with people out there, please feel free to come on board. Health enthusiasts, we definitely bring them on board. My name remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed.